When I'm put in a position where I have to make a decision about something, but I'm not really sure, I'm not clear about the decision, I love to talk to people who are more expert on the subject than me, and I like to ask questions. And two of my most common questions are, I like to ask people, what are the do's and don'ts about this subject? Or what would you do if you were me? And so that's what I'm going to do today about Medicare. I would consider myself an expert in the Medicare business. I don't know everything, but I've been at this business a long time. And so what I'm going to do in this video is I'm going to share with you 8 do's and don'ts about Medicare and also show you what I would do and wouldn't do. So I have 4 do's for you and 4 don'ts. I'm going to start with the don'ts. First off, don't go on Medicare at the wrong time. Folks, not everyone has to start Medicare at 65. Now, some of you have to, for sure. So as we're going to talk about doing Medicare at the right time, there are those of you who have to start at 65. Who would that be? Anyone that is covered right now by a retirement plan of you or your spouses. If that's your insurance, you got to go on Medicare at 65. If you're covered by COBRA insurance right now, approaching 65, you're going to go on Medicare right now at 65. If you're covered by TRICARE, which is your retired military, you've got to go on Medicare at 65. If you're covered by an Affordable Care Act plan, the healthcare.gov exchange plan, again, you're going to drop that plan and go on Medicare at 65. Or last, if you or your spouse are working covered by an employer-provided plan that has 19 employees or less, again, you're going to have to start Medicare at 65. So that's the 5 groups of people that have to go on Medicare at 65. But there's one group that doesn't have to go on Medicare, and that's anyone that they or their spouse are working and there are 20 employees on the payroll or more. You don't have to go on Medicare A, you don't have to go on Medicare B. So the point is, pick your time to go on Medicare at the right time. Now, some people will say that you have to go on Medicare at 65 even if you're working. And they'll tell you if you don't take Medicare, at least Medicare A only, you're going to be penalized. And folks, that's not true. If Medicare A is free for you, meaning 0 premium, because you have 40 quarters paid into the Medicare tax system, you'll never be penalized for Medicare A. It's going to be a 0 premium for you for the rest of your life. And here's my point. If you or your spouse still working and we have this group plan 20 or more and you're contributing to an HSA and you happen to enroll into A only, not B, just A only, then you can put no new money into your HSA. So that's my first don't. Don't go on Medicare at the right time, on the wrong time. Go on at the right time. Now, number 2, and that is don't go without a Part D plan, even if you take no medications. Remember, Medicare has 4 parts. A is the inpatient side of Medicare. B is the outpatient side, as well as all doctor services, in or outpatient. C are called Advantage plans, and D is the drug plans. So these are our self-administered medications. Now, these right here will cover meds when I'm in the hospital or in an outpatient situation, infusions, injections, and those kind of professionally administered medications. But I need a drug plan for those meds that I self-administer. So what happens, sometimes people take either no meds or maybe very cheap meds, and they think they can get by without having a drug plan. Well, the problem with that is that you're just looking at your present situation. What happens if you got cancer or some serious issue in 3 months or 6 months or 9 months down the road? You just can't add a drug plan when you want to. You have to take a drug plan at 65, or you have to take it when you retire, or you can enroll in one during the open enrollment period. You just can't pick up a drug plan at your own will. You have to take those drug plans when Medicare makes them available to you. So the point is this, even if you don't take meds, you can get a drug plan. Folks, there are drug plans in 2024 that are as low as 50 cents a month premium. I saw one the other day, it was a 0 premium. You want to enroll in a drug plan regardless of what meds you take, just in case you would need something in the future that would be expensive. You'll have that great Medicare drug plan to cover some, if not all, of those costs. All right, my third don't is this. Don't select an Advantage plan just for the what? The perks and the low premium. I know both of those are very attractive. In fact, half of all people today that are going on Medicare are going on Advantage plans. And that may be a right pick for you. But I'm just saying to you, don't do it just because they throw in a few perks that original Medicare doesn't offer. And secondly, don't do it just because it may be a 0 premium plan. And the reason I'm saying that is because there's some issues that you are going to have to deal with Advantage plans that you need to be aware of. Again, most agents don't talk about these because they don't want you to be aware of them, because they want you to take an Advantage plan, because Advantage plans pay us as agents a higher commission and a longer commission, okay? But we want to make sure that you're aware of the cost and the coverage that's going to come along with that Advantage plan. Because sure, it may have a zero premium, but it's not going to be free to you for the majority of services you're going to need. If you go to a specialist, it's going to cost you anywhere from $20 to $50 copay. If you go to the hospital, it's going to probably cost you anywhere from $300 to $400 a day, up to a certain limit of days. If you have an MRI or a CAT scan, probably going to cost you $150 to $250. If you had some kind of outpatient procedure, probably going to cost you $300, and on it goes. In other words, you are simply going to pay as you go. So yes, there's no premium for that, but you're still going to pay. You're just going to pay as you go for whatever healthcare services that you need. So you're really just taking on the risk of whatever healthcare services you may need during that year, okay? And so it's not going to be free. There will be a cost, even if the premium is going to be zero or very low. And then the perks. The perks are nice perks. They'll throw in a vision allowance, a dental allowance, some hearing aids, possibly, as long as those are in the network. They'll give you a gym membership. And so some of these things are very attractive. I understand that. But you also have to realize that though they give you perks, it's not because the insurance company is trying to be benevolent to you. It's because they try to induce you to enroll in these plans because these perks are available to you. But what they often do not tell you now, there's also going to be a few disadvantages with that Advantage plan. And one of those is going to be you are going to be in a network, which means what? You have to make sure that all your providers are going to be covered by that network. Some are HMO networks and some are PPO. HMO is smaller than the PPO. But if someone has original Medicare with a supplemental plan, they never have a network. Yeah, they got to pay a premium to have that, but now they can almost go to any doctor they want to go to, any hospital they want to go to. Not so with that Advantage plan. Yes, it has perks, but it also has provider networks that you have to live with that. Secondly, what you're going to have is you're going to have pre-authorizations. Pre-authorizations. And this is a big issue with Advantage plans today. What this means is that you need a CAT scan or an MRI or a PET scan. You need a skilled nursing stay. You need an outpatient surgery. You need a knee replacement. Maybe you need a hip replacement. But there are many services that are not going to be required. They say about 70% of them that have to be pre-approved by the insurance company before you're going to get that healthcare service. And sometimes those insurance companies will approve it immediately. But sometimes they delay it and say, no, we want you to go to therapy first. We want you to take medications first. We want you to try this first. And they're going to have the right to do that. Or they may just simply say, no, we don't believe that. We don't believe you really do need that. And so in an Advantage plan, your doctor makes the recommendation, but the insurance company must approve it. And sometimes, in fact, many times they interfere with that. And so the coverage is delayed or flat denied. If you have original Medicare with a supplemental plan, you never have a pre-authorization by the insurance company. They have to pay if Medicare pays. So they follow Medicare. This system here has the right to actually interfere, and they have the final say-so instead of your doctor. All right? And so, yes, low premiums, yes, some perks, but you also have a couple issues that can be very detrimental to you and your health if indeed you enroll in one of those Advantage plans. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. And now number 4, don't continue to pay IRMAs if you have a qualifying life-changing event. Now, I am shooting this video. Today is actually October the 11th, 2023. Okay. Now, right now, we are still waiting for them to let us know what the Part B premium is going to be for 2024. We do not know that yet. Right now, the Part B premium is $164.90 a month. And this applies to about 93% of the Medicare population. All right. Now, 7% of the Medicare population is actually going to pay more than the $164.90. They're going to have what is called an IRMA, which stands for Income Related Monthly Adjusted Amount. So their total Part B premium is going to be more. And so the way this works is if I'm going to go on Medicare this year, 2023, they look back at 2021, and this is called my Modified Adjusted Gross Income. And on your tax return, this is very simple. You take line 11 and line 2A, and you put those together, and that becomes your Modified Adjusted Gross Income. And so if this number is above a certain threshold, then I'm going to have this IRMA, this additional amount added to my Part B as well as to my drug plan. And so right now, the 2 thresholds I'm going to share with you in this video would be a single filing an individual return, $97,000. That's for the year or less. you only pay that premium. If I'm above $97,000, I'm going to pay an additional amount. There's actually 5 levels of IRMA. I'm not going to get into that now, but if I'm above that, I'm going to pay more for my Part B. If I'm a married filing a joint return, that is $194,000 or less, I just pay the $164.90. If I'm above that, then I'm going to pay an IRMA. Now, I would expect in 2024 these numbers are going to be a little higher. I've been reading about it. Some say it's going to be about 102, 105. This would put that then at 204 or 210. That's just double the amount. And so if we're above these amounts, we're going to have to pay an IRMA. Okay. Now, not only will I pay an IRMA for my B on my Medicare, but I also will have an IRMA for my prescription drug plan. And so let's say if I have an IRMA over here, the first level is about $65. That level is going to be about $12. So the first IRMA level, income levels, are right about $80 a month, and they just start going up from that. And so my whole point is some of you are going to have IRMAs, about 7% of you. However, if we have a life-changing event, there's 8 of those. Those are death, a divorce, marriage, work stoppage, work reduction, loss of income producing property, loss of a pension income, and employment settlement. The last 3 I just mentioned are pretty rare, but the others are more common. Death, divorce, marriage, work stoppage, work reduction. Those are our top 5. And if you have any of those 5 life-changing events and the other 3, then now we have the opportunity to appeal the IRMA. And so what we do when we appeal the IRMA, we fill out a form called an SS-44. And we mention our life-changing event, whatever that is, and we then can tell the government, stop looking back 2 years. So I can ask them to look at 2022, or I could tell them to look at 2023. Next year, they're going to naturally look back at 2022, so I can ask them to look at 2023 in my appeal, or I could tell them what I'm going to make in 2024. But take the time to appeal the IRMAs because they can be substantial, and until you appeal the IRMA, they're going to continue on. And these numbers for the IRMAs and the IRMA amounts are adjusted every single year. So as we roll into 2024, they're looking at 2022, and everyone's going to get their notice about an IRMA if indeed their income was above the particular thresholds for that year. So take the time to appeal the IRMA. By the way, you work with us. We are happy to guide you through that whole process. All right, let's quickly look at the 4 do's. Number 1 do is compare your employer plan to Medicare at 65 and every year thereafter. I said earlier, not everyone has to go on Medicare at 65, but you are eligible. And so who doesn't have to go on Medicare, A or B, would be anyone that's covered by a group plan, your spouse's plan. There's 20 employees on the payroll or more. You don't have to do anything with Medicare, but it is very wise to compare that group plan with Medicare. In other words, if you were to go on Medicare, what's the cost going to be of that? The cost and the coverage. And over here, what's the cost and what's the coverage? So make a comparison. Look at the premium. What's it cost you to be on that work plan? If your spouse is on that, what's the employee-only price plus the spouse price? So we look at the premium. We look at the deductible. How high is it? How low is it? Do you ever meet it? What's the co-insurance? Are you in an 80-20 plan or a 90-10 plan? And after you have met that deductible, then what's the max out-of-pocket that you'd have to pay? If you got cancer, it's going to cost you $5,000 or $10,000. And then look at the medications. What kind of coverage do you have for your medication? And take those same line items, the premium, the deductible, the co-insurance, the max out-of-pocket, the medications, and look at those as it relates to Medicare. So make that comparison because your employer has to let you go at 65. I don't care if someone HR says they're not going to let you go until the open enrollment season for the company. That's not true. At 65, you have 7 months, 3 months before you turn 65, the month you turn 65, and 3 months after to actually enroll into Medicare. And so we begin at 65. And so you have the right, whoever you work for, to go on Medicare at that time. Now, if you don't go on at 65, then that employer can say to you, you can only then make the decision to go on Medicare when we have our company open enrollment season. And I'm just encouraging you every year thereafter, compare your Medicare options to the employer plan. Now, frankly, a lot of employers will let you really go at any time after 65, but there are some that say, no, we'll let you go at 65, and after that you can go on, but it has to be during that company open enrollment season. But my whole point is take the time to do the comparison. And sometimes it makes financial sense to go on Medicare. Sometimes it makes more sense just to stay on the group plan that you're on, especially if your spouse is younger or children on that plan that are going to be younger. And if you seek our advice, we'll be honest with you. If your employer plan's better, we'll tell you so. If Medicare's a better option, we'll tell you why we believe that as well. And now number 6, do consider the main ramification of selecting an Advantage plan at 65. I already talked about Advantage plans earlier, saying it's a pay-as-you-go system instead of a premium, but you still pay. We also said that we have network of providers, HMOs, PPOs. You got to make sure that you're aware of that, especially on an HMO, because you can't go out of the network unless it's an emergency or urgent care situation. So that matters. We also talked about pre-authorizations, how the insurance company has the final say. So just because your doctor says you need it, the insurance company must agree and approve that before they're going to pay for that. Sometimes they do, and sometimes they don't. All right. But this one really is the main reason I mentioned this. If you decide to take that Advantage plan at 65, where a lot of people are doing it today, primarily because they're healthy and they like the perks, they like the low premium, and so they enroll into an Advantage plan. But let's say their plan is to stay on that Advantage plan for 2 years, or they're going to go to age 70. Now they've been on the Advantage plan for 5 years. Here's what happens in all but 4 states in the country. So what I'm going to share with you does not apply in New York, Connecticut, Maine, or Massachusetts, okay? Other than those 4 states, if you are on an Advantage plan at 65 and you stay on it to 67, 70, whatever for a few years, and now you want to get off that plan and you want to go back into original Medicare A and B, and you want to pick up one of those supplemental plans, most people today are getting a G plan or an N plan, and that's what you would like to have now. What happens is, to make the move from the Advantage to the supplemental plan, now you have to go through what is called underwriting. And this means that underwriting process is we're going to have to ask you 25 or 30 health questions. We're going to look at all your medications you're taking now and have for the last 2 years to see what you've been treated for, and we're going to get a statement from your doctor. And that information is then going to be submitted to an underwriter with that supplemental company, and they have every right to approve it, and they also have every right to deny it. Now, when you start at 65, they cannot deny that application, regardless of your health situation, no matter how bad it is. They have to approve the policy. But after that, other than in those 4 states, those insurance companies are not required to approve your application. So many people today will go on an Advantage plan, they stay on that thing for 2, 3, 4, 5 years, whatever, and now they want to pick up a supplemental plan, and they think that they can make that switch just because they want to. Not so. The insurance company now has to approve the application, and they have every right to say no to that. And that's why I'm saying to you, that would be the main ramification of taking one at 65 and staying on that for a year, 2, 3, 4, 5 years, and wanting to get off. You may not be able to get off because now your health has changed. And by the way, I'm not talking about life or death issues. Some companies today won't take you if you're a diabetic, especially if you have hypertension as well. Some will not take rheumatoid arthritis, spinal stenosis. Some of them will not take osteoporosis today. Interesting enough, some of them today won't even take AFib. One AFib incident in your medical records, you are not going to get that supplemental plan. So there are medications that they can cause you to be denied, and certain health conditions as well. And so many people think they can switch just because Medicare has the open enrollment season, and that's not so. We can switch during that time, but if you've been on that for any period of time now, you're going to have to go through underwriting, and you may not get the supplemental plan, and then you'll be on that Advantage plan and in that system with pre-authorizations and networks for the rest of your life. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner, and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions, and they'll show you different Medicare options to make sure that you're confident in the decision that you make. Now, number 7, and this would be a do, and that's do consider the stability of rates before selecting a supplemental plan. Every company is going to give you a rate. If you're at 65, let's say that rate may be $120 for a G plan, maybe $100 for an N plan. Let's say you're 67, that rate's going to be maybe $130. Most states are going to be based upon age. There's a few states that are not, but most of them are based upon age. And so when we look at a premium initially based upon our age, we just call this the initial premium. That means that's what's that premium going to be for the first year. But what is going to happen is those prices are going to go up. There will be increases. There's increases to everything. Advantage plans go up as well, as far as max out-of-pockets and co-pays and those kinds of things. So everything goes up because of medical inflation. But what you want is you want a company that has been proven to be stable. Now, I know what the rate's going to be initially. They quote that. But what will it be in 3 years or 5 years or 10 years down the road? Well, that we don't don't know. So what we like to do as a company, we want to go with carriers that have a large presence in a given market. We want to go with a nationally recognized carrier because there's more people that are going into those groups. So the larger that group is going to be, the more the risk is going to be spread out to the policyholders, and the result is stable rates. If you go with a regional carrier or a small carrier, one that doesn't have a good market share, that's going to be a smaller block of business. And if there's a lot of cancer and health problems in that block, that thing's probably going to go up faster than what you're going to be happy about. But if we go with a larger company, a larger block of business, more policyholders, the likelihood of us having stable rates is very, very high. And so that's why we're saying make sure you don't just look at the initial premium. Yeah, I care about that, but I also care about how has that company performed in the last 2 years. We actually have records. We can look back and see how many price increases they've taken, how often they've taken those, and that's what we're talking about for stability of rates, because probably whatever they've done the last 10 years is also what they're going to do in the next 10 years. So make a decision not just to pay upon initial premium, but also the stability of that carrier, a carrier that's proven to be stable, who takes price increases, but they're very reasonable, they're not frequent, just something that is manageable and very reasonable. That's the kind of carrier you're looking for. And that brings us to our final do's and don't, and this will be a do, and that's this: do consider. And as I share this with you, I'm saying please consider this. Do consider what will happen if the worst were to happen. In other words, if you were to have some serious health issue that would come up, it could be some neurological issue, it could be some brain issue, but something happened that's major. Let's just use cancer as our example. And what I mean by this statement is consider what will happen if cancer were to happen. In other words, how is your insurance going to work if you get cancer? And anytime we talk about insurance, what I care about is the cost and the coverage, okay? And so we've already seen we have two options when we go on Medicare. We're either going to do an Advantage plan or we're going to do a supplemental plan. And so if the worst were to happen, cancer, what's it going to look like as it relates to my out-of-pocket cost and the coverage that I'm going to have for my cancer? So how about the Advantage plan? You're on an Advantage plan that probably has a zero premium. Now you're probably paying Medicare Part B premium for sure, but there's no cost to you for that company. But what's happening? Now you're paying co-pays for everything you do. And what's going to happen the majority of the time when people get cancer and they have an Advantage plan, they max out of pocket. You'll hit the max. Max out of pocket this year is going to be anywhere from about $3,000 on HMOs to about $7,000 on a PPO, maybe $10,000 if you go out of the network. But you are going to pay, and you will probably max out of pocket if you have an Advantage plan. Then what happens sometimes, people get diagnosed with cancer towards the end of the year, they max out, and then max out of pockets renew in January, and then very quickly they max out again. So that easily could be times 2. All right, but that's the cost. Also then, let's talk about the coverage. What's that going to look like? Well, remember, on my Advantage plan, what happens? I've got pre-authorizations. Some things are going to have to be approved of. I also have networks. So am I going to be able to go to every provider that I want to? Maybe, maybe not. So you're going to have to deal with that. If I have that supplemental plan, what's going to happen? I don't have pre-authorizations and I don't have providers I have to worry about because anyone who takes Medicare will take my supplemental plan. And pre-authorizations don't exist. Providers are almost unlimited. Almost everyone takes original Medicare, not necessarily the Advantage plan. So again, your coverage is going to look different. Now the cost, what's going to happen? Well, let's say I have an Advantage plan. Let's say I'm on a supplemental plan. I have a G right now that costs $125 a month. Some are lower, some are higher depending upon where you live. But that's what, $1,500 in the year. If I had that G plan, I got a Medicare deductible of $226. Right? So what did I spend? I spent $1,726 out of pocket the whole year. That's it. I just had to pay my premium and a small deductible. Now, let's say I have an end plan, and that end plan is $100 a month. Well, that's only going to be $1,200, and I got my $226, plus I have some co-pays on my end plan. But the whole point is I can budget for those kind of things. I'm not going to be surprised by things financially as I would be on my Advantage plan. All right, nor will I be disappointed because I may not be able to go to the provider that I'd like to on my Advantage plan, where I'm probably going to be able to on my supplemental plan. And all I'm trying to teach you is this: don't just think about today when you're healthy. Maybe you take no meds and you have no health problems whatsoever. But what happens in 2 years, 5 years, or 7 years, something seriously happens. How is your insurance going to work? How is it going to perform for you? Are you going to be pleased with the cost, with the coverage, if the worst were to happen? All right, I close with this. Let me just add these two. Number 9, number 1, do your homework. Please do your homework. Don't just copy what your neighbor did or what your brother-in-law did. Do your homework. Make sure you really understand the ins and outs of Medicare. Please, at our YouTube channel, which you may be watching this on, we have hundreds of videos available to really educate you. Don't make a decision until you first know exactly what you're talking about. And then once you've done your homework, I would encourage you, the rest of it, don't do it alone. Don't do it alone. Once you've done your homework, get some assistance. Find someone who genuinely cares about you. And how you can know if an agent really cares about you, number one, they're going to take the time to assess your situation, to evaluate, is it really time to go on Medicare? What will the Advantage plan look like? And what will the supplemental plan look like? If you're talking to an agent that all they want to do is talk about the perks and the zero premium, they don't want to talk about some of the dark side of the Advantage plans, that agent's not being honest with you. An honest agent will tell you about both. They'll give you all the details of both, the consequences of both. Because why? You have to live with the consequences of that. They want you typically to take the Advantage plan because it pays us more money. Higher commissions, longer commissions. But a good agent is going to care more about the coverage that you're going to have to live with than the commission they're going to make. All right? And that's what I mean. Do it alone. Don't do it alone. But find someone that genuinely cares about you. Someone will take the time to look up your doctors, to look up all your meds, to make sure you got proper coverage, to show you Advantage plans, supplemental plans, the rates of all those, and talk about the stability in case you decide you want to go with a supplemental plan. Okay, so don't do it alone. By the way, you won't save yourself any money by trying to do it yourself. An agent is going to be involved in that, whether that's in a call center or someone face-to-face or whatever. Someone's going to get paid to help you do that. An insurance plan cannot be written without an agent. Therefore, an agent is definitely going to be paid a commission for that. All right, and so we truly come at no cost to you. And so just be sure you get someone that is reputable, that really understands the business well, and will guide you through the entire process. If you choose us to help, it'd be our privilege to do so. Thanks so much.